Ladies and gentlemen, viewers and listeners, good evening. Thank you for joining us on another edition of Globespan. I know it's been about maybe say 5, 6 weeks since you've last seen me. Been a very busy time, as you can imagine. So with me this evening, I'm pleased to say that I have two new guests to Globespan. We have Dr. Kofi Dalrymple, who is a medical professional, and we have Mr. Gavin Ramsoondar, who is an executive member of the Georgetown Chamber of Commerce and Industry. Now, this evening, these gentlemen will be discussing with me what we are seeing happening in Guyana, in particular as it relates to the COVID-19 pandemic. Dr. Dalrymple, who is a medical professional, as I would have mentioned, is going to take the route of his perspective, explaining his perspective on public health, and Gavin is going to take the perspective of business. So naturally, as you are all very well aware, the COVID-19 deadly pandemic needs no introduction in terms of what it has done, both from its devastating public health impact side, and then on the other side, the measures that are in place, what economic fallout and what impact on business and livelihood this has had. So where I want to start is perhaps both gentlemen giving an assessment of the situation that they are seeing in Guyana. We'll perhaps start with Kofi. Kofi?
Yeah. Richard, thank you first for having me on the show. As a first timer, I want to say, special thanks to you and your team and for your viewers for having me. So what I firstly want to address is, I think what we're seeing in Guyana, and then I think even yesterday, and I was telling Gavin even before I came on, that we saw somebody of prominence, for example, that passed away from COVID-19, Imran Khan, of course, who was former head of the information agency for the government, the last government. And I think that brought home for a lot of people and it's happened along the way, but that we've had these episodes where the reality of COVID has kicked in. And I think there have been these episodic periods where we've gone from, it was just a ploy, to stop the Donald Trump from staying in power, to people started to realize that people were really dying significantly. And then kind of watching those numbers go up in Guyana, and then even the emergence of sort of the Delta variant that a lot of people have even heard about and are concerned about, has really become a real issue at home. I think the other thing that we have seen is, and I still think that this is the case, that we've had a few what we call breakthrough infections, where a few people who have been vaccinated have actually passed away. But what the data still shows is that the large measure of people who are still dying from this disease, this pandemic, are those who are unvaccinated. And we continue to see those numbers every day. I think one of the things that is coming out, and we'll probably see this in the data, is that people who have pre-existing conditions, people dealing with things like diabetes, hypertension, or any one of those chronic conditions, are at very high risk, from passing away here from COVID. And again, I think we're beginning to see a lot of that in the numbers. One of the things that's actually good, and I didn't realize this actually until recently, is that a lot of Guyanese actually have been vaccinated on their first dose, which I think is a good trend. We run into that little snag with a second dose, and so there's a lot of people waiting on their second dose. I think it'd be good if the government could really get its act together there for the logistics. I saw some news today that they're going to focus on second doses for AstraZeneca, for example. And I think 2 days ago, Sputnik, the second dose came in. So I think we got to move those along very quickly and get people fully vaccinated, and then really push to get others in the line to become fully vaccinated. I really think that that's the only way. Well, I shouldn't say the only way. I think that's our biggest sort of gun right now to deal with this situation. hope later on, I hope to talk a little bit about how people really need to start understanding their own health, right? Their own health history, their own medical conditions, because we've got the situation that we found where a lot of people don't know their health condition. And then when you go into a situation, you catch COVID, then it really brings on some serious complications. And even for people who are getting vaccinated and don't understand their health history, I believe that's an issue. Those would be my opening remarks. Yeah.
Yeah, absolutely. Thank you very much, Kofi. Now, of course, naturally, it being a pandemic and it having an impact on one's health, the state of one's well-being is obviously a concern from the very inception. I think one of the things that is peculiar about the Guyanese society is that we seem to have a pretty high incidence of NCDs, non-communicable diseases, here in Guyana, which pits our population at an inherent disadvantage as it relates to if one was to contract COVID. And certainly this pandemic and what is happening maybe makes the argument or bodes well for being able to encourage a healthier lifestyle, nutritional adjustments and changes in levels of activity in the population. So maybe these are public health measures which, coming out when we of course get over this period and begin to come out, those are some of the conversations which maybe need to be had. We can delve into that a little bit later in the program, but I want to hear from Gavin Ramsoondar. Gavin, what, of course, being a member of the Chamber of Commerce and in particular an executive member, you would be privy to a finger on the pulse on what's happening in the economy as it relates to business, and also what's happening as it relates to a vaccination uptake in the private sector and measures that have been taken. What are your thoughts or assessment of the situation in Guyana as it relates to COVID-19 and the business community?
First off, thanks for having me, Richard. It's a privilege to be a part of the show and make my contribution. As it relates to COVID-19 and how it's affected business here in Guyana, initially it was really tough when everything was locked down and the virus was really new. We didn't know what we were dealing with. We didn't know how it was going to be spread. So that initial lockdown obviously did hamper business and the way we operated. Many businesses closed the doors initially until the relevant information came out, and then things got a little bit better with the vaccinations and the guidelines being released by the Ministry of Health, the WHO, the CDC, and other health organizations. But what we've seen recently, this surge as a result of Delta, I think a few businesses now will have to recalibrate their positions and the manner in which they operate. Things were looking good. Globally, things were looking good, as me and Doc were saying. The rates were coming down as people were, more populations were becoming inoculated with the vaccines. But then Delta came, and I think the paradigm has shifted again because of this new variant. And this variant is the most potent form of the virus. You're seeing more breakthrough cases. You're seeing more unvaccinated people, unfortunately, dying, vaccinated people getting infected, and it's spreading to kids as well, too. Thankfully, there are not many casualties on the kids' side. How does that fit into business is now, we now got to think, how do we protect our employees? How do we protect our customers and those who we serve? And the key for survival in this pandemic for businesses is their ability to innovate and their ability to adapt. You have to innovate and you have to change the way you operate. You have to implement safety protocols to factor in the safety and the health of your customers, of your employees. You have to make infrastructural adjustments, such as building prospect glasses over any exposed areas. For the hospitality industries, they would have had to redesign their floor models and the layouts of their restaurant to ensure that the spread of the virus is mitigated and reduced, and this comes as a cost to the business community. As it stands right now, it is not as bad as it was in the beginning, given the fact that more and more people are becoming inoculated and vaccinated. Doc mentioned that it's a heartwarming statistic to see how many people took their first shot in Guyana. It's about 352,000 people taking their first shot, which is about 73% of the target. But the second dose is only 182,000, which is about 38%. So we need to roll out those second doses. That will reduce the amount of casualty. It quite possibly could reduce the amount of the spread of the virus. Businesses, the onus is on them to provide, and I like to urge, fellow businessmen to provide PPEs for your employees. That was one of the first things we did when this pandemic started. We educated ourselves. Then we said, look, we want to provide, these things cost money. They're not cheap, to provide, supplements, sanitation products, masks, and the education on how to be safe from COVID-19. And that's what we did. That was the first thing. We want to ensure that everybody's safe. We provide you with PPEs. We will also provide you with information. Ever so often, something changes. There's some new bits of information that comes out, and the onus is on us to educate our employees and educate those around us. And we have implemented this, and we've done well. We've never had an outbreak in our office, and there's a reason for that. We've really, really took this thing seriously. And I like to urge all the businesses to do it. Business can continue, but just put the right things in place to protect the stakeholders of that entity. And it's an ongoing thing. It's not going to end tomorrow. It's not going to end next month. We're all in this together, and we need to work collectively as a country and as a people to keep each other safe. And the vaccination is one method that we can all, kind of end this. The second thing is that we have to be disciplined. We have to follow safety protocols. Vaccination is one, yes, but not everybody can be vaccinated as yet. There are some people with underlying conditions that cannot be vaccinated, and there are the adolescents. Well, they are now being vaccinated here in Guyana, but those below the age of 12 are not. So we still have to have a moral compass about how we're operating and how we're going about our business. Vaccination, yes. Safety protocols must be intact, and we must abide by these in the way we live our lives and the way we operate our business. I would just like to start with that and continue well.
Absolutely. So, Gavin, thank you for that very well articulated position. I think we've seen, for example, information coming out of the Johns Hopkins University, their public health center that they have there, indicating that vaccines are really a first line of defense or first defense mechanism, tantamount to if you're walking through the snow and wearing snow boots and wearing snow gear. Snow can still enter in beyond it, but it's not as prevalent as it would be if you're walking without any gear. But of course, we've seen that there has been, both in the developed world as well as the developing countries, a degree of hesitancy as it relates to persons taking the vaccine. So, Gavin, I want to ask you, as you're already on the topic, and then we'll go over to Kofi. Do you believe that the private sector has a greater role to play in reducing this hesitancy as it relates to vaccines, and how perhaps can this be done?
We all have a role. We are stakeholders, the private sector, and yes, I can speak on behalf of the private sector. We have a major role in terms of if there is hesitancy, why we need to identify why is that, or why is there a hesitancy? And in most cases, it has been lack of information. Some individuals may not be previewed to the same information that I am, or other people. They may not have access to the different sources of medium. It is our duty as business leaders, as company owners, as stewards or managers of a company to educate those. We are all in this together. It doesn't matter if I am vaccinated and you're not. That is not going to change anything. We need to reach herd immunity. And that is why it's important that we urge everybody. We don't want anybody to get sick. We don't want any employee to get sick. Your chances of getting in or going into the ICU are significantly reduced if you're vaccinated. We're seeing that in the death. Globally, 90-something% of the people in ICUs are unvaccinated people. And that's the same thing here in Guyana. And as the business community, we have a corporate responsibility a duty, a moral duty to educate those around us and educate stakeholders around us. We've seen many businesses already in Ghana hold vaccination drives for their employees, hold it for the wider community, off of their place of work, if it's a large compounder of so forth, as a vaccination site. That is what needs to be done. The businesses need to support the community and the country as a whole, and we all need to come together and do that, and the provision of education is important. Of course, if businesses are in position to provide PPEs to those less fortunate or who can't afford it, I urge businesses to do that. We're all in this together. If we can't safeguard our own self and watch everybody else out there suffer, it's a wider community, and that's the moral obligation, the ethical obligation of a company. It's not just for its bottom line or its profits, it's for its stakeholders. And that should be encompassed in a company's corporate social responsibility guidelines and their policy. The community as a whole, give back in what way we can, education, provision of PPE, facilitation of vaccinations and so forth. Yeah.
Absolutely. And, a couple of things, as someone in and around the business community, who also has some amount of background too in health economics and looking at business transformation and business processes transformation. I've always thought that what we're seeing here in terms of companies transforming the way that they relate to employees, companies transforming the way that they are concerned about the well-being and welfare of their employees to a greater extent, the embracing of technology, changing of the way and the manner in which people work with flexible working hours and schedules, etc. Some of these coming out of the pandemic, I believe that those changes may be expected to stay as permanent features of businesses or permanent features of the economy. Now, Kofi, I want to ask you a question here. What I know Gavin has alluded to education, but how important is education and information and the way that it's being translated? How important is it, and what do you think can be done to educate persons in a manner that directs them to be more informed and also to cross that line to taking?
So I think that's a really good question. So there's a couple of things I would say here, right? This is the first pandemic in our lifetime. I think the last one was the Spanish flu. So this is unprecedented. Let's agree on that, right? The next thing is, I think in many ways, the COVID situation has really exposed us as a world, right, and as a country. So when you look at where people get their information, who people trust to give them information, is an important part of the education cycle, right? So if people constantly get their information from Facebook and social media and elsewhere, like, that hasn't really changed, right? They have turned to those sources for their information and something that's a significant impact on their life, i.e. the pandemic. And so that's where they want to get their information. That's one. Two, scientific information hasn't always been immediately accessible. So when you start hearing things about antibodies and you start hearing terms, about herd immunity, and you start hearing about RNA and DNA, I mean, these are things that some people we just learned in high school and then we forget it, right? And we don't even think about it anymore. But all of that information, right? All of that comes bearing down on the average person almost instantly when COVID sort of came out. And so I think it's a tough thing for the public to now digest, right? I've had people say to me, they say, Doc, you're fortunate because you understand this thing. You understand the science here, right? You used to make vaccines at one time. And so you understand, but me, I don't understand what you're talking about. I don't understand what it is they're putting in my body, right? So the hesitancy, right, comes from some of the ignorance because it just isn't, we just don't have in large measure sometimes a society that's completely scientific, right? We still have in large measure a society that is very traditional and very conservative. So it's very hard to walk up to people and say, let me give you an injection of a new RNA vaccine, right? And so I think that's what education has to do. I think there has to be a concerted education campaign targeted at what Gavin said earlier, at the reasons for hesitation, which means you have to study and understand why people are hesitant and then be able to develop strategies to target that hesitation. And some of it might be, I don't understand the science. I don't know what is in there, right? You have to target that. Some people might say, I don't know why this vaccine came on the scene so quickly. Vaccines usually take 10, 20 years to happen. How did this happen so fast? I think we can't take the approach to turn around and say, and sort of dismiss people's concern, because these are real concerns. And I think you have to bring the information to people and sort of begin to explain to them, right? There are answers to these questions, right? And I've been part of campaigns where we've held, discussion sessions with schools or groups to answer their questions. We say, just come with your questions. We'll sit down and we'll talk. And you can raise any question, no question, conspiracy theory even, right? We'll sit down, we'll dissect them, and we'll go through. And we have found significant success by doing that, right? I have a number of friends, for example, that I've spoken to on the issue of vaccination. A friend and I, we do a show on Facebook where we talk about vaccination. And we've seen a number of people after getting that information went out and they got vaccinated, and now they're proponents for vaccination. They're talking to other people about it. When you look at the issue of trust, as I said, if somebody doesn't trust you, it's very difficult for them to get that information from you. And I think that's one of the challenges that we find as well in our society, right? That there are times, for example, and this isn't a critique of the government per se, but I think that if you could see more healthcare people talking to the public and bringing that information out, right? People that they can trust, I think that makes it easy for people to sort of accept that information. The last thing I would say, and I pointed to it earlier, is that our relationship with our doctors or the medical fraternity has always been, I'm only going to go to those people when I'm dying, when I am near death, when I am sick. So we haven't really built up over time this idea that we should have a relationship with our doctor, a relationship with people in the medical field. And so because we don't have that relationship, when something like this happens, right, we don't know who to reach out to. We haven't really spoken to them. We don't have access to medical information. And that becomes a difficult thing, I believe, for people. Where are you getting your medical information, right? Everyone will go to Google and they'll try to type something in Google, and you'll get the good and the bad, right? And you go to different places and there's nobody there to really talk to you about your own health, right? Your own conditions, to be able to address this issue of vaccination. So I think education is of prime importance at all levels, right? At the medical level, like I said, between you and your doctor, on the global level, right? At the national level, where we're communicating information, but also on a personal level, people talking to friends and sharing information, right? And talking through issues. Yeah, maybe I had this side effect. This is what happened. This is what I did, right? Or I didn't have any side effects. Like, share your story, tell your family, tell your friends, right? And get rid of this hesitation.
Absolutely, because I think one of the things that I found to be interesting is, of course, the role that what is called in psychology as the confirmation bias playing in this entire thing. So someone who may not be familiar with research or research methods, how to go about sourcing information from a credible source, they'll go into Google, they'll put does the COVID vaccine make me impotent or an alien? And then they're going to see a website. They're not sure if it's a real website or a fake website. And they click on it and they see some very bizarre kind of explanation, but then they take it and run with it. It's not that the individual is to be blamed. They have conducted what they have deemed as being research. So it's that is why personal interaction and being able to have this relationship with medical professionals is very important. I must say, however, though, that I am of a very strong view that the medical community in Guyana needs to seriously look at doctors who or medical professionals who are not or who are discouraging persons from taking COVID-19 vaccines. There are persons who are indicating to the general populace that, for example, I know of a case where someone went to a public health facility and they were told they showed their vaccine card, and a medical professional said, well, it seems as if you don't want to make children in the next 2 years. And things like that, it's resounding in the mind of the general public. If someone who is working in medicine doesn't even believe in medicine, it's as if you are asking an attorney and their recommendation is total anarchy. It runs counter. But I just want to give a bit of a almost live update. I saw Dr. Mahendra Karpin posted on his Facebook recently at 7-8 minutes ago, September 28th, and then I guess this is the morning of 29th. 5 more deaths, all unvaccinated, but interestingly, all many persons there are young. None can be considered as being very elderly by any stretch of the imagination. 28 years old, unvaccinated, 33-year-old, unvaccinated, at 17-year-old, unvaccinated, 55, and then 66. This is very unfortunate, that this is happening, and I hope that we are able to be able to curb through like we have been identifying through information, etc., through educating persons, curb some of this hesitancy and really drive vaccination in Guyana. I think part of also, maybe before we go to a brief break, Devin, in the background, but before we go to that, I think part of what we also have to examine too is what role culture or culturally how we have been influenced in our lifestyle. So, for example, we come as a people from a very hard-working, laborious, labor-oriented type of background, where persons worked in the rice fields, the sugar industry, bauxite, etc., doing manual labor, where they required a high amount of carbohydrate intake, etc. And many of what we deem as being our national dishes are heavy in starch, heavy in carbohydrate intake, and far beyond what is required for the contemporary use of an individual. And we're accustomed eating those large amounts of rice and roti and all types of things. I've seen recently that there appears to be a link between obesity and COVID-19 deaths, whether it makes you at a greater disposition of actually contracting the virus or the symptoms manifesting themselves in a more serious way. So I think at some point in time, we also need to start the dialogue on that. A healthy Guyanese will obviously be better. An individual healthy Guyanese, when you submit that, you'll have a healthier workforce, the increased productivity driving the country forward, and the impact on the public health infrastructure will be much less. So at some point, we will need to commence that conversation, but it's one which needs to be had. I think at this point, we're at 7:35. We're just having a 1-hour program this evening. So Devin, maybe you can take it away to a break.
Thank you to all of our Travelspan and Amros Travels customers and staff. We are still operating after COVID shutdown thanks to all of your support. Our staff has made the best efforts during COVID to speak with the airlines on your behalf. They stayed on hold for hours sometimes with the airlines to rebook your reservations. We are happy to serve. Our offices are operating at 10809 Liberty Avenue, Richmond Hill, New York, and our Val Park office and GT offices are open as well. Travelspan survived these 27 years with our customers, staff support, and God. In our 27 years, we are grateful to be here with you in the community. So call us today in New York at 718-845-0437. In Trinidad, call 645-1604. And in Georgetown, call 227-1701. And Rose Hall, call 337-4287. Get your meals delivered directly to your home. Order your curry, duck curry, goat, or chicken, plus your Dalpuri roti and bus-up-shut from allfromOneSupplier.com. We ship your meals directly to your home, so you can enjoy it upon arrival or refrigerate it and take it out when you're ready to eat. No more waiting in lines and no more losing time. Now you can treat yourself with a tasty curry and roti. You can also order solos, ices, pear jacks, coconut water, and much more from allfromonesupplier.com. It is free shipping to all U.S. states on all your curry, duck curry, goat, and chicken, plus sodas and all West Indian items. So treat yourself or send a gift box of your favorite food, tasty pastries, sweets, and coconut water, or any West Indian item, products such as fish, meat, curry powders, pepper sauces, and much more from allfromonesupplier.com. Call today at 718-551-3292 or visit allfromonesupplier.com. Remember, it's free shipping throughout the U.S.
All right, ladies and gentlemen, viewers and listeners, welcome back. As we are on the home stretch for our program this evening, we're chatting here with Gavin Ramsoondar, executive member of the GCCI, and Dr. Kofi Dalrymple, a medical professional. So I wanted to, we of course left off the conversation before going to the break on the role of diet and the role of nutrition in actually encouraging persons to ensure that they live a healthier lifestyle. But there is, of course, the other end of the spectrum, where when persons who are who have been living that lifestyle believe, for example, that they should not be vaccinated, or they should not in any way, have protection from the COVID-19 pandemic. So, Gavin, do you want to delve a little bit into your thoughts on that?
Right. And again, I'm not a doctor, but this is, the general consensus here among anti-vaxxers and the people who haven't taken the vaccine is that if I'm healthy, if I eat the right food, there's no need to take a vaccine. And that has proven to be furthest from the truth. We've seen healthy people, we've seen athletes die from COVID-19. Up to yesterday, I was being told by my boss, actually, that a boxer, a Guyanese boxer, who I don't want to mention his name, it looks good, looks fit, looks everything. He actually died of COVID-19, and he's healthy as an ox in Trinidad and the other islands. We've seen this. The virus affects everybody differently. Yes, if you're healthy, you live a healthy lifestyle, you have a strong immune system, that's a line of defense, but it's not the first line of defense. Richard, you mentioned it, the first line of defense has to be vaccine. Don't play around with this virus. It's relatively new. It's a novel coronavirus. Yes, it's a strain or a cousin of the SARS virus that we previously saw, but this is fairly new. Do not play around. Don't take things for granted. The vaccines are there for a reason. It's free. Go out and take it. It's your first and your strongest line of defense from getting terminally ill or even dying. Most of the deaths, as we're seeing in the news every single day, 90-something% are unvaccinated people. Yes, you will find one or two fully vaxxed or partially vaccinated, but I think Doc alluded to that earlier, that those individuals more than likely had underlying and chronic illnesses, and there are breakthrough cases. Especially with the Delta variant, the most potent form of the virus. So get away from this misconception that you're healthy. Yes, you are healthy, but that is a good thing. The ultimate thing is the vaccination. This all ends ultimately when everybody is inoculated and has some form of immunity to the COVID-19 virus. That's how it ends. Because ultimately, what's going to happen? I believe, in my personal opinion, that we may all, and I know you shared this before, we may all become infected with the coronavirus, with this COVID-19, at the rate at which we're going. So it's imperative that we take that vaccine as our first line of defense, get some form of immunity to it, live a healthy lifestyle. That's good. That's not only good for COVID, that's good for everything. But this is right now, this is a pandemic. The easiest and the safest thing to do, don't leave anything to chance. Take your vaccine. That is proven. Any medical expert will tell you that.
You know what I find to be very interesting as a conversation as it relates to this is that persons say that we don't know what's in it. Or as Kofi would have mentioned at the beginning, we don't understand why it's been produced this quickly. You know, what I find interesting, before I ask Kofi to comment on that, is that the general public perhaps has more information on COVID-19 vaccines than they have had for any other single vaccine, perhaps ever in the history, or at least in modern history or contemporary history. We are talking about vaccination technology. We are talking about things like efficacy rate. We are talking about booster shots, and people are understanding what mRNA is as opposed to antiviral vaccines, and when things have been broken through. I want to ask Kofi to perhaps give a comment on this. What would you say to people who are advancing that line of argument?
Yeah, I'm probably going to say to them they don't know what's in their Coke either.
Exactly. I was going to say order chicken burger, order chicken nuggets, or Advil.
Yeah, that's cocaine at one time, People just drank it. Again, so I always take the position that and as I said before, so I'm not a medical doctor, but I've worked in vaccine technology as a scientist and lead a healthcare company. So I talk to doctors and patients every day. And so I actually feel, I empathize with individuals who have these questions. To your point, there's been more information, but there's been a lot more questions. But I totally empathize with individuals because, as I said, we are in a pandemic. And so the consciousness of these vaccines are right in front of us, right? And everybody's got to take it. But you're right, we've taken every other vaccine, right? And when we need to go to a different country and we become permanent resident in the United States, you have to go and get all your shots. If you're a student and you have to go overseas and study, you got to get all your shots. It's just to go to school, you need all your shots, right? I think part of the challenge is that a lot of this also became very political, and then political became religious, and I'm not going to go there. But let me answer your question, though. And I spoke to someone on this before. I have sat in design meetings where we are planning to make vaccines in facilities. And Gavin spoke of some things that businesses have to do today. Now, you have to go in and plan who can come in and who can pass who, and where you're going to wash your hands and stuff. Well, I used to design vaccine. I'm still a little involved in designing companies that make facilities that make vaccine. I can tell you, right, the side that where one person comes in, they can't walk back out the same side, right? There's one clean side you got to go through, and then there's a dirty side you got to get through on the other side. Everything is absolutely scrutinized, right? Down to salt. If you put salt in this stuff, right, it is scrutinized all the way down to the smallest ingredient in there. And so we have to know what's in there. This stuff then has to get studied. It has to get characterized. It's got to go to the FDA. It's got to go through so many hoops. We have on purpose set the standard for vaccine injectables. At some of the highest level possible, right? This stuff is above food, right? You eat food, and there's a certain amount of germs that are allowed with food. I think it's the number of cockroach legs that they go in and they find. They say you can still eat it, right? But when it comes to vaccination, I mean, you can't even have a cockroach 2 miles close to this facility, right? I'm telling you this. I've been there, I've experienced it, I've seen it. So when I sit and have this kind of conversation with people, I'm like, look, man, vaccine and vaccine technologies have been over the years, right? Something has been heavily scrutinized. Because no, we've had issues with vaccine in the past. Don't get me wrong, I have to be real, right? There are things that have happened in the past that are real and people are concerned about it. But over the years, I can tell you the regulations that have been put in place to deal with vaccine and to understand what's in a vaccine and its effect on the population, the standards for those things have been, they've been elevated. I mean, really, really high. This was one of the challenge, for example, where people talk about an approved vaccine versus an authorized vaccine. This was another issue that people had. It's not approved, it's authorized.
That's exactly what I was going to ask you. If you just want to give our viewers and listeners a bit of an insight as to what the difference is between emergency authorization and then full authorization.
Exactly. So the process, the easiest way I could explain it, and I tried to explain this to a taxi driver, I said, imagine you have a food stand, right? But you can't sell food to the public just like that. The authorities are going to come and say, you have to demonstrate that your food is safe. And not only safe, they want you to provide a ton of information, even though they know, let's say you were selling mangoes, they know that mangoes is generally safe. They still want you to provide a ton of information to prove that it's going to be safe. They don't want to take any chances whatsoever, okay? That is where, when we look at vaccine approval, the burden that you have to go through, the amount of information and the timing of the information, right? I don't want to say it's bureaucratic, but you have to provide a lot of information before they decide, look, we're going to also evaluate whether this thing is a public good. Does it add any new information to the public? Is it just a waste of the public's time to have this new vaccine or this new medication? So they look at all of that when they decide they're going to approve a vaccine or even a medication. In the case of an authorization, what they do is they still go through all of the safety information, right? They still go through all the safety information, but what they do is they relax some of the bureaucratic requirements, right? Because they already know that this thing is required, right? And necessary and needed. So they have the data, right? And they can go ahead and look at that data long before you even finish your report, for example, and decide, you know what, the risk to the public is so great that we can't wait for full authorization, which is largely a paper process, largely, an administrative process. And they go ahead and administer and said, look, we're just going to authorize it. We've already seen the data. The thing is safe. Let's go out. We can do the paperwork later. And I'm sure many of us have been in businesses where you've gone and you said, look, the deal's done. We've got everything worked out. Tomorrow we'll come and we'll finish all the paperwork and get everything tied up. And that's the difference here. The thing is set, it's safe, it's ready to go. They've got the information. This is not one of those cases where the information comes in. Nobody looks at it and says, yeah, just go out there and try it, right? You still have to do all your clinical trials. You still have to show that it's safe and effective. We call it in the vaccine industry safety and efficacy, right? You have to demonstrate that even before the vaccine gets an emergency authorization. After that authorization, they'll go through the paperwork, they'll finish, they'll tie the bow, as we say, we'll put the bow on it, and we'll call it fully approved, right, towards the end. But in a pandemic, you can't wait for that, and there's a process to deal with that, right? There's a process to deal with that, and that's the emergency authorization process. But it does not relax the safety and efficacy requirements.
All right. I think also a lot of persons have to understand that the environments which these vaccines are being produced in are held to very high standards, and generally labs have their own certification process to even become an operational lab. So Thanks very much for that, Kofi. That was very informative. And I see our viewers commenting that too under our chat box. I want to ask Gavin a question, and this is particularly from a business and an economy standpoint. And it's a very simple one. Gavin, do you think that we will ever return to what we had or what we had seen pre-pandemic? Do you think that life will return to normal, quote unquote, in the business community, or are we going to see in the future a sustained feature of economies being very volatile and this counterbalance between economic prosperity or public health safety?
That question, Richard, is a very good question, and I believe it's relative to the country, and how things have changed as a result of the pandemic. First off the bat, I knew one of the things that happened as a result of the pandemic was the ability to work remotely, and that has changed a lot for companies, because now they find that their employees, they're seeing different motivation levels, they're seeing different efficiency levels. And having employees work remotely can reduce the administrative costs for companies globally. A hybrid approach now is being tied with in most nations, most first world nations that implemented this. And what this has resulted in is the reduced reliance on the rental of office space. I know of companies in North America who rented large floors. Now they've reduced that. So there are the pros and cons. Some companies can benefit profit-wise because there's a reduce in administrative expense, but that has a loss to somebody else who's involved in the real estate business. And that's on the remote working side of things. In terms of a general economic recovery, I do believe we will get there someday. I don't believe that this is going to be permanent. And once herd immunity is reached and once normalcy resumes, I think business will return to normal, but it's not going to be for now. We see in countries where there were 0 active cases, normalcy resumed. For example, New Zealand, a country with 5 million people, had rigid COVID-19 protocols, and they had 0 active cases. In 5 million people, they had 27 deaths. 5 million, 27, and that's because of the discipline of the people and very strict COVID-19 guidelines. And you know what happened, Richard? They were able to open up as per normal. Cricket per normal, rugby per normal, everything happened per normal except the people coming into the country. They had to do some kind of quarantine, and rightfully so. And they implemented one of the first countries to implement a vaccine passport. But it just shows that once there's 0 active cases, once everything is good, normalcy can resume, and that can translate into an economic recovery. I do believe so, yes, but it's not going to be now. And the onus is on everybody in the country. The onus is on the lawmakers to implement strict COVID-19 guidelines in certain areas. And the onus is on the people. Be disciplined about it. Understand that we're in this fight together. Don't take things for granted. Don't just focus on one geographic area, like in Georgetown, and then things are happening, Wild West, like on the East Coast or Berbice and so forth. We have to have a macro effort across the country, and as long as we have that effort, as long as those guidelines are in place and people are disciplined and we follow, we take our vaccine, normalcy can resume. And normalcy means economic normalcy as well as the social normalcy. So it goes both ways. We've seen it in New Zealand. I like to use them. They're the benchmark. They have the blueprint of how things happen. And that is something that we need. You need strict guidelines, and you need disciplined people and people who are committed to the fight against COVID-19, and normalcy will resume.
Yeah. Thank you for sharing your thoughts, Gavin. I have one more question here before I ask you, gentlemen, for your final thoughts and wrap up the program. I want to ask Kofi. Kofi, how does this end? How does the COVID-19 pandemic end? How How can Gavin and myself go and sit somewhere without having to have our temperature checked? Gavin wearing his N95 mask, which he's notorious for wearing at all points in time, even if he's out somewhere drinking a bottle of water. How does this end? How can we ever get back to normal? Kofi, I think you're on mute.
Your mic is muted. Sorry.
Sorry. I don't believe that there is a going back to normal, as I believe there's going to be a new normal. What that new normal looks like is anybody's guess. I can say what I hope the new normal looks like, and I hope it looks like what you just described. That we could all do this in in the backyard cafe or somewhere in Georgetown, sitting out at the Marriott or anywhere in Georgetown, just having an open conversation. Where how we used to say, spray it, say it, don't spray it. And that it's not a life-threatening thing anymore, right? To have someone talk in your face.
You can't do that now.
I know, it's dangerous, right? It's dangerous to have that. My thing is so I think Gavin touched on this a little bit. Here's a couple of things we have to do. First, I think vaccination has to get up. This is how we get to the end of this. I think we have to reach herd immunity, one. I think two, our health status is going to have to increase. We're going to have to take health more seriously, because remember that COVID-19 is not going to go away, because it's here, it's in the general population, it's around. It's going to be like the next flu, for example, which is what I'd imagine. And then with vaccination, it just means that it's something that you get. Oh, I had the cold this weekend. I should be able to say I had COVID yesterday. I'll be away from work for 2 days, but I'll be back, right? That's sort of the way it should go. But for those of us who aren't taking our health seriously, even with the front line of vaccination, right? We got to go further, as many of you have said here tonight. And now we've got to take our health seriously, which means we're going to have to start going to preventive healthcare, seeing our doctor at least once a year, and start managing conditions that we had and taking that more seriously. And for those of us who have never seen a doctor, we're going to have to start becoming aware of what our clinical history is to understand what the impact of COVID could be on our own lives. So I think those are two really important things to take into consideration. I think wearing of mask and hygiene will also have to be something that maintains. I don't know if we're going to continue to wear masks. I know in certain Asian countries it's pretty standard, right? In some places where people wear masks all the time in public. I don't know if that's going to go away per se. I wish it would. I do like to see people's faces when they smile and we're talking. I think that really helps the human interaction. But I think that's where we're going to go. I think we're going to have to get vaccinated. I think we're going to have to get our health up, and we're going to have to become used to a little bit of change here in the future. I wish I had better news. I'm sorry.
Your mic is muted.
Yeah, sorry about that. It took some time to come on here. So thank you so much for that response there, Kofi. Gavin, what are your final thoughts as we begin to wrap up here this evening?
Well, my final thoughts, my final comments is this is not going to end anytime soon. And we all have to work together, the business community, governments, citizens, everyone, every single stakeholder of a country, not a company, not a business, of a country. We all need to work together to get this through. It's not going to go away just like that. It starts from rigid policies, vaccinations, and the practice of proper preventative methods from the citizens of a country. Mm-hmm. It's not going to end like that. Doc mentioned that things are going to change. Yeah, we may never return to normal, but in the meantime, we all need to work together. We need to collectively work together to end this. And it's not just vaccines alone. It's not just going to end it. We need policing of policies, and we need the support from the citizens of a country. It has to be a collective effort. One party can be doing it, and somebody else is not abiding by it. We all need to get out there, get vaccinated, still practice your safety protocols, and the policymakers need to have a good look at things and make proper assessments of the situation. It's been done in different countries before. It can be done in Guyana, and the sooner that we reach normalcy, everything becomes, or at least go back to what it was before. Social normalcy, maybe, and economic recovery will happen. And Richard, I want to stress this again. Once herd immunity is reached, and once the country has, minimal active cases, industries and sectors like hospitality, restaurants, tourism, air traveling and transportation, these and cinemas, entertainment, they can resume to normal activity, normal levels of activity. That can only be done once the active cases are down, deaths are down, people are vaccinated, herd immunity has been reached. And it's a collective effort. We all need to do this together. Okay. And that's my closing comment for now. Thank you.
Thank you, Gavin. Gavin, what you're saying there underscores something which I've been observing. This has actually been for many independent nation states that are perhaps former colonies, the first pandemic that they're going through. So Guyana as a republic or as an independent nation state, this is the first pandemic that we're going through, as with many other countries that are former colonies, etc. This will have to be the largest cooperative effort that we have had to make. We're going to have to embrace each other. We're going to have to support each other. We're going to have to ensure that we are benevolent, that we take up our responsibility. And we really need to understand as a people that though we are provided and assured liberty and freedom under our respective constitutions, that freedom and liberty is also circumscribed by responsibility. And that is very, very important. I want to ask Kofi. Kofi, give your final remarks, if you can leave the viewers and listeners with one main thought or idea. What would you say in closing?
Yeah, I say to people, that, well, first, go get vaccinated. If you're not vaccinated, let me say that. I want you to remember that if I don't say anything else. I think, though, that there's, and you both have pointed to it, a huge moral obligation here. I don't believe that we are often aware of how connected we are. And the irony of this is that COVID-19 has really shown us, both nationally as a country and as a world, how connected we are. That one person, that first person who was infected, right, could then eventually spread a virus throughout the entire globe. That just shows how connected we all are. And that means that to fight this, it's going to require a connected, concentrated, and united effort. When we think of the healthcare system, it really is a resource to all of us. And often people don't think of it until it's gone. But the healthcare system is a resource to all of us. And if we don't treat that resource in a way that preserves it, which means that if everyone is showing up to the hospital, to the healthcare system sick and overwhelms that system, that means that system collapses. And if that system collapses, then our society as we know it could collapse just from a health perspective. So I think here is where we have to stop, like you said, and we have to forget what side of politics we're on, which side of culture or side of the economic ladder we're on, and realize that in this, we all have a responsibility, like you said, Richard, to ensure that we preserve these resources, right, that support us as a people. And this is why I think there is the push, and this is why we are pushing for things like vaccination and so forth, because we are looking to ensure that we do not create a collapse of the systems that support us, our healthcare system, Gavin mentioned our social system, and our economic system. Not until these things are gone, then we're going to miss them, and it's going to be total anarchy. So I think we have a personal and moral obligation to protect these resources by doing what is right, which I believe today is to get vaccinated if you can. See your doctor first if you have to, And if you can get vaccinated, go get vaccinated. Let's stop COVID-19 together.
Thank you very much, Kofi, for that. So, ladies and gentlemen, this brings me to the end of the program. Certainly, we have been able to cover a number of very relevant topics, both from a public health perspective, a development perspective, and also as it relates to business and the economy. So I wish to thank you, gentlemen, both Dr. Kofi Dalrymple, Gavin Ramsoondar, for joining me here this evening. I know that this is your maiden time here at the Globespan 24/7, but I hope that it is certainly not your last. So thank you both very much for joining me this evening. It's been a pleasure chatting with you, gentlemen. Both continue to keep up the good work, and I certainly look forward to you all coming on the program again. Ladies and gentlemen, I want to encourage you all, please, as Kofi would have mentioned, go see your medical professional if you're having doubts, and certainly ensure that once you can, ensure that you can take your vaccination. Go ahead and take it. Thank you all so much for joining me this evening. Have a good day.
Thanks, Richard, and thanks.